Hello, and welcome to CatTV News. I'm Haley Jamison.
And I'm Brian Scott. Our top story today concerns some updates to the football arena. Roger Cody has more.
Catamount football fans should be in for a new surprise this fall. A new scoreboard will be constructed, and it will be ready and functional by opening day next season. The new scoreboard at E.J. Whitmire Stadium will be an exciting addition for the upcoming football season. The scoreboard will stand more than 50 feet above ground, which is higher than the concourse level of the Ramsey Center. The featured aspect of the new scoreboard is a new video screen that spans 32 feet wide and 17 feet high. This screen will provide play-by-play footage as well as instant replay. This type of scoreboard is featured in many universities across the country and is expected to further establish the Catamounts as one of the premier football programs in the Southern Conference. For CatTV News, I'm Roger Cody.
Now that we know about the new scoreboard, let's find out about how this scoreboard will affect the WCU football team. We interviewed WCU football player Nathaniel Sedgren for the Inside Scoop.
Well, I think the new scoreboard will affect us in a positive way. It will bring a lot more excitement to the games, hopefully bring out a lot more fans. The games will be a lot more hype. Hopefully it can just bring a lot more excitement to the games. The way that it should affect between the competition is when they're coming in here, it's going to be more of a home field advantage, a lot louder of a stadium, showing player bios, little clips and stories, highlight tapes. It should be very exciting, and it should hopefully give us a lot more home field advantage. My thoughts are just pretty excited about the new scoreboard.
Spring sports are about to start their season, and this year is expected to be a great one.
Let's join Cannon to find out what all the Catamount fans can expect this upcoming season.
Hi, I'm Cannon Miller, and I'm here with Steven Nataro, the senior catcher of Western Carolina's baseball team. Hi.
Hi.
So when does the season start?
It's coming up very soon. It's actually February 19th, which is next Friday.
Okay, and who do y'all play?
Gardner-Webb.
All right. What are some of the big games this season?
This year we actually have a lot of big games. We play Georgia, Clemson, Tennessee, which is actually we have a home game with them. East Carolina, West Virginia, so some big teams, big ranked teams.
Okay. How do y'all stack up against other SoCon teams?
This year, we're looking pretty good. Some of the polls have come out, and they say the Catamounts are somewhere in the middle of the pack to the top of the pack. But I think once we start playing, it'll really turn some heads.
Okay. And what happens if y'all win the SoCon tournament?
If we win the SoCon tournament, we go on to the regionals, which is our big goal, and then to win the regionals, go to the Super Regionals, and then we go to the College World Series, which is a big deal. It's on ESPN and everything.
All right. Well, thank you, Steven. And everybody come out and cheer on the baseball team this weekend.
What happens if you get hurt at school? Are you covered medically? Is the school insurance really the best one for you?
Megan Hagler and Courtney Ebajay have the details.
I'm here reporting about the new healthcare reform and how it will affect students in the future at Western Carolina University. I spoke with students and faculty about their views and opinions on the new healthcare reform and how it will affect them. Here is what one student had to say.
What healthcare plan do you use?
Blue Cross and Blue Shield.
Okay. And are you familiar with the new healthcare reform?
Not as much as I'd like to be.
And do you support it, or are you against it, and why or why not?
I support it because a lot of Americans can't afford health care, and it's really important that they get this because it's not fair that they have to suffer and they can't get their medicine when they need it.
Okay, good. And also, do you realize that as a Western Carolina student, you are obligated to have health care insurance?
Yes, I am aware of that.
Okay, and do you think that's a good thing or a bad thing?
I don't think it's fair because not every student, the zero contribution FAFSA, obviously you can't afford health care, even if it's a student plan on top of that.
Okay, thank you very much for your time.
Obviously, healthcare reform is important to students at Western Carolina. We also spoke with Pam Buchanan, the Director of Health Services, to find out more about the on-campus insurance and how she felt about the healthcare reform.
Could you tell us about the insurance plan on campus for students and what it offers for students?
Sure. In fact, we're in the process of changing the insurance as part of the entire UNC system next year, starting in the fall of 2010. the insurance product that will be offered has a $250,000 max student benefit per episode of care, and covers pretty much anything a student needs or a covered life needs outside of the health center. So if you were to go to the hospital for surgery, if you had to have an MRI, a physical therapy, or if you need pharmacy items from a local drugstore, then it's covers the same things most major comprehensive medical plans does, just probably not quite to the extent. Most plans have $1 million max and ours doesn't, but that's the main difference.
Okay, and do a lot of the students on campus actually choose the on-campus insurance plan?
Probably about a third of the students eligible or required, if you will. It is a mandatory policy. Again, some of this is changing for next year, but if you're enrolled in more than 6 semester credit hours, you'll be required to have either the mandatory student plan we offer or have your own insurance. So of those people that are required to have it, about a third typically need it.
And how important do you think it is for students to have health insurance while they're here at Western Carolina University?
Absolutely, vitally important. My background before coming here is all in the hospital. I've seen what happens to a patient, whether it's a student or a 50-year-old. If you have catastrophic medical expense, it becomes this debt that you can't get out from under if you don't have health insurance. For a student, something as simple as having your appendix taken out is going to cost you $15,000. I want you to stay in school and not get buried under that medical debt, and insurance will help do that.
Okay. And so the new healthcare reform, how do you think that's going to affect the students at Western Carolina University and the other institutes around this area?
I'm not real sure. I mean, there's a lot of talk about students or patients, the general public, that falls through the cracks that don't currently have health insurance, but most of that's related to employers that are able to offer that. I suppose if a student's parent, my assumption is that students that need our insurance can't get insurance through their parents. So if the parent is more readily able to get insurance outside of the university setting, say for the entire family, then the student would have coverage to waive with. So, the fact, if it opens up coverage to other folks that currently don't have coverage options now, then I think that's the way it'll impact the offering that we have here.
Okay, thank you very much.
Healthcare reform is a very important issue that students at Western Carolina University should be more aware about. I'm Megan Hegler for CatTV.